FreshPod is created for industry professionals and is intended for educational purposes only. This content is not designed for patients or consumers.
Every week, allocate time, but this is working on the business time. Dive into the dashboard and understand. Lean into the Fresh community if there's numbers that you don't quite understand how it connects to your business. Don't be afraid to feel a little bit uncomfortable. Think back to when you're in the hospital and you probably had to pick up a syringe for the first time. You would have been nervous then, maybe a little shaky, and now everything's old hand. The more you practice, the better you get. That's where confidence comes from.
Welcome to FreshPod, your warm, practical, non-jargon space for clinic owners who are ready to grow with confidence. I'm Loz McGlynn.
And I'm Dr. John Delaney. I'm a medical director and co-founder here at Fresh Clinics. If you've ever thought, I don't even know where to start with improving my business, this is the episode for you.
The truth is that most clinic owners have no formal business plan or even a structured way to track what's working and what's not.
Our State of Medical Aesthetics report showed that only 18% of clinics have a business strategy in place, and just 24% are consistently tracking performance metrics. That means most people are just winging it.
So we brought in the best. Meg Reid is a part of the Fresh Clinics team, and she has decades of experience helping clinics spot hidden gaps and unlock some serious growth. She's going to walk us through how to do a business health check, and hopefully by the end of this episode, you are equipped and excited to go through the process yourself.
So, Megs, thank you for being here.
Thanks.
How great to have you. You've been involved in this industry for decades. You've seen hundreds, probably thousands of clinics. What's a business health check, and what are the key sort of things that go into it?
Look, a business health check is an opportunity to take a step back, open the hood and take a look and say what's working and what's not working. I like to think of it a bit like a blood test. You go to a doctor, you get a blood test, and they let you know this is going great, your cholesterol's great, Megs, but let's really focus on your iron. And sometimes when you're rushing and you're going throughout your day, you may not even realize that you have low iron. So you need someone, or even yourself, to take a step back and think what's working and what's not. Normally, when I go into clinics, I do see a really strong focus on the clinical side, the safety side, patient care, 100% needed. But the health check gives you a checklist and a chance to step back and think, okay, how's my marketing looking in terms of devices and skincare? When is it time to bring that in? Business fundamentals, which is something that everyone does tend to shy away from. We know in the State of Medical Aesthetics report, it showed us that 18% of our clinics, have some form of a P&L or a business plan, which means the majority of us don't. So it's just that step back. These are the things I'm doing really, really well, but where's the opportunity? What can I be focusing on to really help my clinic hum?
I think that's so true too. Like for a lot of business owners, they are clinical like they either come from a therapeutic background, like a hospital environment, or this is the first time they've owned a business.
Yeah.
They're trying to learn so much and be patient focusing. Yeah. And a lot of them like I said, a lot of them haven't been in business before. So it almost like, I feel like sometimes people avoid it because it's like, it's not a strength. So I'll just focus on what I'm good at, which is treating my patients. What are some of the common gaps that you see or blind spots that injectors business owners might have when it comes to their business?
I always think about, what a nurse learns in their university degree, and then what they learn when they're in the hospital environment, and the things that aren't covered in that space. That's where the gaps are going to be. And the biggest one is usually business fundamentals. P&L statements, KPIs, even those terms you don't learn those in the university or in the hospital environment. So as soon as someone starts asking nurses in clinics, hey, what's your profitability? You definitely see, nurses pull away because it's not familiar to them. So I definitely think just basic business fundamentals. A P&L is simply how much money did you make for the month and how much money did you spend for the month. In terms of how much money did you spend, you're looking at things like rent, the product that you purchased, the gloves that you had to wear. So that's that bucket there. And then literally how much money did you make for the month, and whatever's left, that's your profit. And it could seem really overwhelming, especially, as I said, when you're hearing terms like a KPI and a P&L, but that's really a basic fundamental. So that's definitely that nervousness and that uncomfortability about learning business. But if you really strip it back, that's all it is. How much money did you make and how much money did you spend? Once you get underneath that, that's when you start looking into something called a KPI. What's a KPI? It's called Key Performance Indicator. So it's what's working in terms of how many patients are you seeing, how many patients are coming back, and then we can talk a little bit more about that.
Yeah, you raised, Megs, an interesting point, which is the training that I went through as a clinician and that the registered nurses and other healthcare practitioners that work in our network and others have gone through. It's often a dynamic group environment in which they learn, university or the hospital system, where someone who's experienced will teach you how to do it. And maybe you'll be learning with other people who are learning for the first time. That's one of the key differences that I see in this industry is people are isolated and their learning is often then self-directed. And if it's an area that you're not familiar with and you don't know the terms, perhaps it's easier just to self-direct into things that you're more comfortable with. So
I 100% agree. And that is what I see a lot of.
Yeah.
I go into a clinic and the patient care is through the roof. But in terms of their business mindset or focusing on that side, it's unfamiliar. So, I see nurses in clinics pulling away from that.
So do you think it's familiarity that stops people from diving into this sort of stuff more? Or
Definitely.
what do you see?
I think so say when we're running webinars,
Yeah.
On new techniques or a new product, there's a lot of engagement there because that's what nurses are familiar with.
Mm-hmm.
But leaning into the business side, as I said, terms like KPI, KPIs, P&L, it doesn't mean much yet. So that familiar piece is I know this, I'm really comfortable over here in the clinical aspect, but the business side, it's do I need that? I think a lot of nursepreneurs out there and clinic owners think maybe I'm not there yet. And they think I'll get to it when I'm there.
And that human thing where we don't think we'll be good at it straight away,
Yes.
so we just avoid it because I don't want to make a mistake and I don't want to get involved in it, and it's probably all just a bit too much. So I'll just give that to my accountant, or I'll just ignore it. And as long as there's some money in the bank account, I guess everything's going fine.
That's right. I think a little bit of that imposter syndrome creeps in as well.
Yeah.
Like, I even found that nurses and clinic owners didn't even want to ask their accountant questions because they didn't want to feel silly.
Mm-hmm.
And that's the perfect place to be asking. Ask a million questions. So what can I do better in that month? Why was I successful in that month? Why did I make so much profit in that month compared to another month? So it's that not wanting to look silly, that imposter syndrome, that leaning into what's comfortable over here in the clinical space, I think is really what deters people. And it's not easy. It's not like there's a really simple way to jump in and learn unless you go hunting for it.
Yeah, that imposter syndrome is it's so common, and even with the journey that John and I have been on with Fresh Clinics, we're clinicians too. We've come from the hospital. I was an emergency registrar, and then all of a sudden I'm trying to manage P&Ls and and cash flow and all that sort of stuff. Some of it you got to learn on the fly, but getting comfortable with feeling a little bit out of your comfort zone is probably the first step to getting there, I think.
Yeah, definitely.
I think the other thing too is, and this theme will come up a lot in this series, is like if you're treating patients and you're working in the business, you are also wearing so many hats.
Absolutely.
And so to put on another hat is like another thing to do, and like the bandwidth might feel like it's not there.
Yeah.
But I also think that like it is a fundamental part to the success of your business.
100%.
Planning. And so like you've mentioned a couple of different things, Megs, but if you were to give some small action items or resources or tools that an injector or a business owner could use to start looking under the hood, what would those tools be?
Look, the number one thing is really understand your patient numbers. The amount of times I've gone into a clinic and the number one concern will be, I don't see enough patients. And the first thing I look at is their rebooking rate. And the rebooking rate is always significantly lower than where a healthy business check would show you. So often when I go into a clinic, it might be about 15% of patients are rebooking, but 55% of the Australian population are open to having cosmetic injecting. So for me to have that rebooking rate so low, it's an opportunity then to think, okay, what can I do better? How can you do your consultation stronger so that the patient understands they need to come back in 3 to 4 months for their tox? What can you be doing in your consultation to really cover the safety aspects so that the patient knows I'm in the best possible place, I'm getting the best possible care? A lot of people think that patients, it's, the number one reason why patients may not come back is price. That's actually the third reason. Number one is actually, am I going to look weird? And that can be covered off in your consultation, full end-to-end consultation, giving the patient the confidence that you're not going to look weird because of all of my expertise. Show some before and after images once they're in your clinic so they can understand the results that you can offer your patients. But I think it's that understanding your patients, their journey, that's definitely number one, because the biggest concern I hear from clinics, even today, is I don't see enough patients. But as soon as I start digging in and I take a look at that rebooking, they're there. It's just let's focus on getting them back in. In terms of just an easy win, the Fresh Clinics dashboard is amazing. All of those health checks that we go through, they're there. So I think it's giving yourself permission to step away from the business. And I think, back to your point, John, I think there's a bit of guilt in stepping away from the business because I'm not busy back to back seeing patients all day. So therefore, I'm not doing the right thing. But 100% block yourself out, actually block time out in your day. Lean into the Fresh dashboard. There's videos if you're unsure on how to understand all of these numbers because it can feel overwhelming at first. But I think it's that. Give yourself permission to step back and understand your metrics, but you're on the Fresh network. And the biggest thing is your patients. You have to understand that cycle and when they're coming in and why.
Another thing that we also look at is like your margins. So looking at particularly, like, it's hard to do that with some portfolios, but I know from like a tox perspective, we actually have an internal resource that can be used with our account managers, and it shows like what is the percentage margin on different tox brands and then what you're charging, and you can look at dosing and stuff as well. And I know a lot of members that I speak to, even just understanding what their average dose is, and looking at that as well, because like I think everybody, well, not everybody, but I know, like, even for myself, a lot of injectors that I speak to, they don't want to feel salesy. They don't want to feel like,
Definitely not.
they're like, well, I'm doing what I'm doing because it feels comfortable, but that might not necessarily mean that there isn't opportunities to make little changes that then have a really positive impact on your overall revenue as well.
Yeah, the dosing part is really important. I know what it's like when you're in an environment and the patient comes in and says, I only have this much money, so can I get my whole face done for that? And if you're not super confident in your consultation and really explaining to the patient why that's not the best outcome for them, I have seen nurses in situations feel backed into a corner and do what the patient's asking as opposed to delivering what the best outcome is for the patient. So that will really be identified in the dosing if that's happening continually. And it's seeing those patterns and then leaning in and asking for support from the Fresh team as well.
Yeah, it's a common trait in healthcare professionals to give of yourself and be a people pleaser.
Yes.
The two hats that need to be worn here are you've got to satisfy your patients, but you've also got to be building a sustainable business over the long term. And for me, I think you touched on something there, Megs, around price and how often that is what people feel like is the most important. But it's actually value that's the most important.
Yeah.
So the price is only a function of how much value you provide. And value doesn't mean dosing.
No.
It means you as the injector, as the service provider, what are you providing that sets you apart from the person down the street, from the plastic surgeon down the street?
Yeah.
Why are they coming to see you? And the data shows us it's not price, it's service, it's connection. And patients want to feel that connection and feel that trust. And I think sometimes the confidence is lost that it's you that's providing that value, you that's providing that confidence.
Yeah.
And people should, I hope, feel that and feel inspired to continue to build that, to grow their clinic.
Some of the best treatments I've had over the years is when I've gone in thinking I'm going to have one particular treatment and I've been getting treatments for 20 something years now. And through the consultation process, my injector actually says, Megs, this is actually better for you for the outcome that you're here for today.
Yeah.
And that's coming from me, who's been in the industry for a long time. And I think I know what I need. And I walk into my injector saying, okay, just do a bit of this and this. And through that consultation process, again, I see value and trust.
Yeah.
And I listen then. I'm like, oh my gosh, that's amazing. And then following that treatment, I'm so much more happy with the outcome because the nurse offered me advice that I couldn't even see.
Yep.
At Fresh Clinics, we believe business growth doesn't need to be complex. Whether you're tracking KPIs, managing your team, or refining your patient experience, we've built you a custom insights dashboard to do it all with ease. Access these insights to give your business a health check alongside so much more in our resource hub, exclusively for Fresh members. Visit Fresh Clinics to learn more.
And so for those clinics out there that are looking to grow their business, how does the business assessment change, or what sort of metrics do you think then are different or that they can focus on separately?
Yeah, as I said, the number one thing you start with is obviously patients and understanding what's happening in my patient flow. Then you need to take a look at and say, okay, for growth, how many patients do I need to see a week? And just that simple metrics is something that I find that not many clinics know or understand.
As in setting yourself a goal.
Setting yourself a goal.
Yeah.
Yeah, definitely setting yourself a goal. You should set a goal quarterly and revisit the goal monthly. So it's not every month push. It's like, okay, so we're starting a new financial year, 1st of July. How many patients do I need to see every week and every month? And then every month you review it and you say, I'm on track or I'm not on track. And if you're not on track, that's an opportunity to assess maybe your social media performance. Maybe in your consultation, again, it's your opportunity to wow your patients so that they, through word of mouth, they tell their friends and family, oh my gosh, I found the best injector. I don't know where you're going, but you've got to come down and see, Nurse Loz, she's amazing. So definitely goal setting. I talk a lot about patience because I just think there's so much hidden information in there, whether it be dosing or returning habits, spend as well, and understanding if you're cross-promoting well. So definitely taking a step back, setting those goals, start with patience. We do here at Fresh have a health check that you can download. There's 8 pillars of a health check. So everyone thinks that it's clinical and maybe a bit of marketing. There's actually 8 aspects of the business that you need to be looking at. And on the health check, there's between 5 and 8 questions for each section of that health check. And that will help you say, do you know what? I'm doing really well in this section. Pat on the back, because it's really important to, reward yourself for the wins as well. But it also will point you to, okay, I really need to lean into, say, business metrics, or there's a section there on when is the right time to introduce a device or skincare, or there's a section in there on introducing a new employee into your clinic. When should I and how do I develop them?
Yeah.
There's, as I said, there's marketing. So there's 8 pillars. So I definitely recommend going in and downloading that check and, open the hood. Don't be afraid. Lean in and see what's working well and what's not.
Yeah, I think the other, you mentioned the marketing pillar, and I think that's the first thing people think about when they think, I want to grow, so let's open up the checkbook and start giving money to Mark Zuckerberg. It generally, it's important. That stuff's important. I think what's more important is actually tracking where your leads are coming from.
Definitely.
So when a patient comes into your clinic, particularly if you haven't seen them before, making sure you find out, ask the question, how did you hear about us? We see all that in online materials all the time. How did you find out about our website? That's why they want to know. Because people will be surprised. I think you'll be surprised in your own clinic. Where did someone come from? Were they referred by a friend? Did they find you on Google? Did they find you on social media? Did they see an email campaign? Whatever it is, because that information is gold, because then you can know, well, I should double down on that strategy, referrals. I should double down on whatever it is that's driving patients to your door. Double down on what's working and then save the money on what's not.
On the health checks, number 1 is safety, compliance, risk, and clinical. Number 2 is patient understanding. So it's absolutely before marketing and, diving in and throwing money at the wall. You've got to understand your patients. And the health check the dashboard actually lets you know the age as well. And if you're finding a lot of the older generation are coming through, I don't know if older generation is the right term. Older demographic.
Our generation mix?
Yeah, our generation. I'm not on TikTok.
Yeah.
If you want to get me, probably an old school Instagram or Facebook ad. I still fish around Facebook. So definitely understanding your patients before you start diving into campaigns and spending money where you don't know who you're attracting and why.
Yeah, I mean, the other thing is the networks from which most clinics are pulling their patients are local networks.
Yes.
It's uncommon for most clinics to be pulling patients from suburbs far away or cities far away.
Yeah.
So referral remains the absolute bedrock on which your clinic should be built and should grow, driving word of mouth through great service and value creation, but also other ways that you can incentivize people to recommend their friends is all very good.
100%. If you have a patient coming in that's through word of mouth, they're coming in engaged. They've already had their best friend, their sister, their mother say, this is the best person you need to see. So that first hurdle of gaining confidence has already been covered by an advocate who you've already seen.
Yeah.
So word of mouth 100% is the best sort of patient you can attract.
Yeah. I think two things that you have said that's like really important is like everything else starts with knowing your business and the fundamentals of your business. Like you can't do the rest without understanding that. Also, you don't just like look at your business once and then that's it. It's a consistently touching back in to really understand where are you performing. Like most people in, like corporate environments, like we have that as well. We look at, how are we performing? How are we tracking? Like, what are our values? Like what do we want to achieve in the next, 6 to 12 months? Jada's a stickler for that. No, I'm kidding.
Fresh Health is redefining modern healthcare, integrating preventative and health optimizing services into nurse-led clinics. With structured medical oversight, expert consults, and streamlined systems. Be part of the shift toward proactive, patient-first care. Discover what's possible at freshclinics.com/fresh-health.
If someone what's some advice for someone who just will say like, I'm not any good at business?
Which I hear all the time, and you are, because you have a business. So again, it's leaning into what makes you uncomfortable. So, lean into the Fresh community. We have lots of resources that you can jump in and learn about. Really take a step back and say, okay, what is a P&L? And as I said, it's how much money did I make and how much money did I spend? If you have an accountant, really ask him to help you set up with understanding your P&L and your performance for each month. But definitely the first step, as I've said earlier, is give yourself time. It's okay to step away from the business, and you should factor that in, every week, allocate time, but this is working on the business time. Dive into the dashboard and understand. Lean into the Fresh community if there's numbers that you don't quite understand how it connects to your business. Don't be afraid to feel a little bit uncomfortable because you're going to have to lean in. Think back to when you're in the hospital and you probably had to pick up a syringe for the first time. You would have been nervous then, maybe a little shaky, and now everything's old hand. The more you practice, the better you get. That's where confidence comes from.
Yeah, 100%.
And so lots of that training can be done in a self-directed fashion. There's lots of great resources, and many people will use some of the cloud-based accounting services, Xero, MYOB, etc. They've got lots of great learning tools. But when should someone be seeking outside support or mentorship? And are there any kind of thoughts around ways to shortcut that?
Look, in a perfect world from day one, but obviously, the most important thing, as I said, the first pillar is around clinical safety and risk. Once you have that under control and you've got a little bit more of an understanding about your patients, you've started dabbling a bit in marketing and you really are ready for that. That's when I think you're ready for the next step. You're like, okay, I've dabbled a bit here. I know about my patients. I'm touching on the Fresh dashboard. Now I want to get some more support and more help. We do have courses through Fresh that you can attend. We have webinars that you can jump in as well. But otherwise, absolutely a great place to reach out as well as your accountant because they can point you in the right direction.
We're working on a partnership at the moment with a company called Sleek, SLEEK, who do accountancy as a service, and they're a really great organization. So
Perfect.
If anyone's out there and they don't have a good accountant or they're looking around, these guys are excellent. The other thing that I've noticed is you've got to learn enough to be able to understand and speak the language, but there's also a opportunity cost of your time as an injector.
Yes.
And so if you reach the point that you're spending so much time on marketing and so much time on your accounts, that you're actually not working on creating value for your patients, that's probably a good indicator that maybe some outside help for social media, some outside help for accountancy is a good way to allocate your time and your money. But you've got to do the work to know enough that you can help steer the ship.
That's right.
But getting that outside help when you find that your time is being compressed so that you're not able to treat patients in the way that you want.
Yes. And if you're feeling overwhelmed in the room because you've got some unanswered invoices that you need to follow up with your accountant, that's definitely the tipping point. Because if you can't be focused in the room with your patient and you're feeling pressures of other outside influences for the business, definitely seek help.
And I think just a learning point that I came across in the early days with Fresh when it was me in zero mucking things up is there's a difference between an accountant and a bookkeeper. So you can get an accountant and you can get a bookkeeper. You can get both. And a bookkeeper will help you to reconcile your accounts in zero. They can help to pay your bills, and you can just feed invoices to them and they'll pay them. And they'll make sure that your accounts all match and work and look good. And then your accountant will process your BAS, your tax return, and those sorts of things. So there's a subtle difference. Bookkeepers are often cheaper.
Yes.
So you can get a bookkeeper for $60, $100 a week, something like that, maybe even less, and they'll tend to your garden, make sure that it's looking nice and all the weeds are pulled. And then when it comes time for the accountant to come in and deal with the tax obligations and things like that, then everything's ready to go and you're not paying the accountant a lot of money to tidy up things, and they're not going through a shoebox full of receipts and all that sort of stuff. So that's a reasonable thing to look into as well. And often that'll be a part-time, couple hours a week. You can find someone nice to help you with your books and make sure that that's all tended to.
I think too, it's knowing what you're more comfortable with. If you find you're naturally responding fast to your accountant and, you've got all of your invoices up to date, but you're leaving your social media account looking a little, little dull, then that's where you lean in and you get support there. And if you're comfortable in this space, you keep running down this course. And then as you get busier again, you take another look and say, okay, now I need more support on the accounting side. You'll naturally find that you're more comfortable in certain aspects of the business, and that's great. Lean into where you're comfortable and get support where you're not.
Yeah, for sure.
The other thing that you have mentioned a couple of times, Megs, is like the community. And I think, we are surrounded by people who are all doing the same thing as you, and they're going through it, they want to know about it, or they've learned from it, or they might be experts in that space. And that's one thing that I really love, is that you really see everybody be willing to be like a little bit vulnerable to share their experiences and advice,
good and bad,
both in clinical and in business. Last question, Megs. We've touched on a lot of great things, but if someone was to finish listening to this episode and they want to walk away and action one thing to get started today, what would be that small thing that you would suggest?
Lean into the dashboard, really trying to understand your patients and where they're coming from. Fresh does have a lot of webinars. We have Fresh Business, which is a course that you can come and learn about a business health check and how to action those things in your business. So I know I've said 3 things, but 1, take a step back, learn your business, understand the dashboard and your patients, and then when you have the time, start the webinars and the Fresh Business side as well.
I'll jump in with one if I may. I think it's important to pay yourself.
Yes.
And I mean that formally.
Yeah.
Right. So if you're running your own business, you've got to work out what your break-even point is. And that is, how many patients do I need to see? How much money do I need to bring in? This is the P&L, right? How much money do I need to bring in that my rent and my injectable expenses and all that sort of stuff's covered, and I get paid?
Yes.
Work out what your salary is. This is something to talk about with your accountant, because that all has tax implications. But at that point, that's the point that's your starting goal, is I need to reach that point, because at that point, my business is not losing money, it's not making money, but it's not losing money, and things can go along as long as you like that. And then you can turn dials and levers to increase profitability from there. But that's the first point to understand and to get to, is what's my break-even point with me getting paid, and then everything else can flow from there.
Yeah, I'll just add in a point as well on a P&L. In terms of one thing that you can do is understand how much money you're spending each month and then how much money you're making each month. And how you do that is you physically pull up a piece of paper, and I'm old school, write down or, type in, this is how much rent is per month. This is how much I'm spending per month on tox, on filler. This is how much I'm spending on all my consumables, everything that you spend in a month. Then take a look at how much money you're earning from your patients for the month, and that will give you if you're at a state of profitability or not. If you are not at a state of profitability, this will tell you how many patients you've seen. So that will tell you how many more patients you need to see per month to get to break even. If you are exceeding that, fantastic. And then it's understanding the levers that got you there.
What a way to finish, guys.
Right.
Solid chat. Thanks, Meg.
Thanks.